Welcome back to the Healthy Zone. Joining me now is Dr. Claudia Fosket and Emily Beecher from Southtowns Radiology. Thank you both for being here. I'm excited that we're going to get to talk about this because October is Breast Cancer Awareness Month. And Doctor, we get into this month, and tell me about mammograms and what every woman should know.
Well, I think the most important thing that all women should know is that mammography, screening mammography, is the best way we have to fight breast cancer. And in the last 20 years or so, we've seen at least a 30% interval decrease in breast cancer-related mortality. So what we want all women to know is that they should start having their screening mammogram at age 40 and every year after that.
Okay. And how important is, with early detection of breast cancer, how curable is it if it's detected early?
That's the most important thing. That's what screening mammography is all about. We want to get it as soon as possible when it's the tiniest few cells there.
Sure.
And we have a very good way of treating it then. We've got very good cancer survival rates with breast cancer.
What if you're younger than the age of 40 and you find a lump? What should you do?
Immediately go to your doctor. And your
Don't
doctor
put it off.
Do not put it off. We do diagnose breast cancer in women in their 20s and 30s, so it's not impossible for those young women to get breast cancer. So do not ignore it. Immediately go to your doctor and they'll order some imaging exams.
How do you describe what a lump feels like in someone's breast?
A lump, you know, if you think of putting a super ball inside your breast, you can sometimes feel the margins of it. If you feel anything that doesn't belong there, sometimes if you're feeling both of the breasts and one breast feels a little lumpier than the other, that might be an early sign of breast cancer.
Okay, so absolutely get it checked.
Absolutely.
Okay, Emily, October's Breast Cancer Awareness Month. Tell me about what Southtowns Radiology is doing.
Well, we do a variety of things to get ready for Breast Cancer Awareness Month. And we actually kicked it off a couple weeks ago. We did an event with Cancer Services Program that provided free mammograms and clinical breast exams for uninsured women. And then we're also participating this Sunday with the Making Strides for Breast Cancer Walk. That's part of the American Cancer Society. We've got a great group from the office that are going, and we're a sponsor for the events as well. So it kind of kicks us off for the month. It's a great month for us.
And where do people get more information if they're hearing about this and they want to take part?
They can go to southtownsradiology.com. That has got information about everything from mammograms to the x-rays, CTs, everything that we do there is also a part of the website, and they can get some information about some different things that we do to make mammograms fun. We do mammograms and manicures, which is a party for women. Yeah.
You forget you're getting the mammogram,
right.
you're getting the manicure.
Not at the same time,
right.
But you get your mammogram done, and then you go and get a free manicure, and it's a party for women, and we have some information on the website about that as well.
Are there things that women can do to make the mammogram a little bit more comfortable? In terms of maybe when they get the mammogram, what, particular?
You don't want to do it the week before you get your menstrual period. Probably like the end of week 1 or the beginning of week 2 is probably the best. Your breasts are less sensitive. But I think the best thing is to go in there with, a relaxed frame of mind. The more uptight you are, the more uncomfortable it seems to be.
Right, exactly. Well, the machine isn't exactly.
Yeah, I think it's got a bad reputation. A lot of women say, hey, this is not as bad as I thought it was going to be.
Well, and I mean, for so many reasons, it's so important. How important is nutrition with breast cancer?
Well, they've found that certain things do tend to increase your risk of breast cancer, like alcohol, high-fat diet. So, everything in moderation. Have a good, good healthy attitude about eating, drinking, and exercise.
What about, there's the mammogram and then the sonogram, and there's a few schools of thought about whether you need the sonogram with the mammogram?
Well, the screening mammogram is the most important thing. And then we use sonogram and MRI as an adjunct to the mammogram. So if we see something that we're not sure what we're looking at on the mammogram, then we'll go to the ultrasound. And that typically tells us whether we're dealing with something solid or cystic.
Okay.
Solid masses we worry about, cystic masses we don't.
Okay, thank you so much for the information. And Southtowns Radiology is just an amazing place to go and get everything done. Do you wear pink all month?
We wear pink a lot. During
I hope so.
Absolutely. Yeah, everyone gets into it.
It unifies everybody. Isn't it amazing
when
you see? Yeah, so hopefully here's to healthy Western New Yorkers at Southtowns Radiology. Thanks for being here, ladies. Appreciate it.
Thank you. Thanks for having us.
Coming up next, Chef Binks shares a cauliflower with sweet potato recipe, so I want you to stay right there. We'll be right back.